All right. My name is Erin Colburn. I'm the pre-health advising coordinator for the College of Health Sciences. Today, if you're in this room, you are a freshman, hopefully, who's interested in a pre-health pathway, and this is your cohort meeting we're going over for March. We have a couple of questions that we would like you to ponder throughout the session tonight about volunteerism, experience, patient exposure, and observation. And Ian, why don't you go ahead and push the next slide over? And we're going to get going. So I'd like to introduce to you Taylor Willis. She is our occupational therapy student here at Boise State University, finishing her doctoral degree program. And she's been doing some presentations in workshop format, and we've recorded them and we'll be releasing them in the next week. But she wanted to talk to you guys about some time management skills and information. Take it away, Taylor.
Thanks, Erin. Thanks for the introduction. So today we're going to be talking about time management, and I think this is a skill that we develop over time. I don't think we're all great at managing our time, especially freshman year. I struggled with this a lot, and so I know that this is a common struggle. And so we're just kind of go over the topic. We're going to kind of analyze our week and just kind of see where we're at. And so time management is the process of organizing and planning how to divide your time between specific activities. And so we see this most of school, right? You need to make sure that you get your assignments done. You need to make sure that you study for that test and that you have good management of that. But with that, we want to work smarter, not harder. So if we don't have to do it, we shouldn't do it, right? Why should we add it to our schedule if it's not necessary? And so I found this kind of cool strategy. It's the 4 Ds. And so there's do, so you can choose to do it. You can choose to defer it. And so you can choose to maybe, I'm not going to do it right now. I'm going to do it a little bit later. You can delegate it. So if you're doing like a group project or something and you kind of took on too much of that load, why don't you transfer it to somebody else or delegate it to somebody else who is at equal playing field, right? And maybe get that off your plate when you committed too much, or delete it. If like I said, if you don't have to do it, don't do it. We don't want to add these extra things to our schedule because it just gets it murky, just bulks it up. And we don't want that, right? And as we're thinking about time management, we want to focus on what matters. So what matters, that is all up to you. It depends on what you think. So obviously you all are students, and so that's going to be the main thing, right? You want to be successful students. You're all interested in pre-professional schools, and so you want to be good students and you want to do volunteerism, right? Observation and all these different things. Well, that's going to be important, and that's going to dictate your time schedule. And then limit distractions. This can be hard, especially like freshman year. You're meeting a whole bunch of people. You're trying to be social. There's just distractions left and right if you live in a dorm or any of the resident halls, right? And so limiting these as much as we can, although it can be difficult. And so, like she said, I'm an occupational therapist. And so occupational therapists deal with meaningful activities, which we call occupations. And so that is divided into these categories. And so we have activities of daily living, or ADLs. And this specifically looks at like getting dressed, showering, all the fun things. Then there's instrumental activities of daily living, which is like cleaning your house, driving, making food, all those fun things. Then there's that's IADLs. Then there's like health management, which includes nutrition, physical activity, medication management, sleep, right, education, work, play, leisure, and social participation. And so everything you do in life can technically be categorized within these occupations. And so if you go to the next slide, we're going to do a little activity. So either today or, yeah, let's do today. So let's do Monday. So we're going to take about like 3 minutes, and I want you guys to kind of divvy up what you did for each specific hour. And then I want you to categorize that into a specific occupation. And so like ADLs is like you getting ready in the morning, walking into class if you had any in-class persons, or getting ready to go on Zoom. School, right, would be one category. Are you participating in physical activity? That would be health management. And so kind of divvying it up, and I'll give you some time to do that. And then after, we'll kind of discuss and see what you guys saw.
Is there any way that we could see the last slide? I don't remember all the different categories.
For sure.
Thank you.
Okay. And so as you guys were doing it, let me know what you found. So did we find a lot of play? Did we find a lot of social participation? Where were we spending most of our time?
Is it all school? It better not be all
Nods,
school.
yeah.
Do we sleep? Got some nodding of the heads. There's some sleep going on. It's a good sign. Have you guys
Yeah.
thought about this?
And so I think this is really beneficial. And so although you guys might be a little quiet, right? 5 o'clock on a Monday, you're tired, so am I. Look at this, use this as kind of an example. How is your day going? If you're spending all day in school, that's not fun. Like, no one wants to do that. You're just freshmen, right? You don't need to be spending all that time in school. We want to be making sure you're getting 8 hours of sleep. Are you having fun? Are you participating in different school activities? With COVID, that's hard, but at least trying your best. Are you making time for self-care? Are you making time for stress management? All of those things that kind of contribute to being a student, that is important. And so making sure you hit all those categories as a student, sometimes you don't find play, right? And so making sure that we include it. And so I put in this last blurb because I think it's like mind blowing a little bit. But if we spend 10 to 12 minutes invested in planning out your day, so using like a Google Calendar, a planner, even just like writing it down, you'll save at least 2 hours of wasted time and effort in that day. And so planning is important. I think we all know that. Thanks for participating and kind of walking through it. And I hope you guys benefited from it. So thanks for letting me come talk to you guys.
Before Jennifer and Ian get started, there's also in the chat a link to the playlist for all of the videos that Taylor has done, anywhere from time management to stress management, anywhere from burnout to health management. And if you want something to watch on YouTube, you can certainly use that. And please let me know if it doesn't accessible for anybody, but you should be able to view those in the playlist. Jennifer.
Okay, so if you want to help people, this is just a brief definition of what volunteerism is. This definition is off the Service Learning homepage on the Boise State website. So volunteerism is the engagement of students in activities where the primary emphasis is on the service being provided and the primary intended beneficiary is clearly the service recipient. It is not linked to the student's coursework nor to academic credit. So I just read this whole long definition. So to kind of put it in more simpler terms, volunteerism is any activity or engagement within your community, within school. And this is beneficial for you in the long run. And it's not really linked to your coursework or academic credit. It's more for your personal and professional growth. And now I listed here different types of volunteerism that you might be a part of in the future or might be searching for as in regards to volunteer opportunities. So the first one is activities and roles. Now this one is probably the most obvious. So it might be something that's already available within your reach. So a position or opportunity within your school or community. This can be including direct service or somewhere within your skill level. So that's just activities and roles. For the second one is time commitment. There may be a volunteer opportunity that's just one-time opportunity. It might be an event or another work place that you could volunteer for, or it may be episodic, so it can be an annual opportunity or event. And I know I listed travel here, obviously, maybe sometime in the future when everything is back to normal, it might be like a travel opportunity where you can volunteer as well. So I just included that in. Third is project structures. So this can be a current or ongoing project going on within school or within your community, and service learning is a great example for this as well. And the last type of volunteerism is social action, and so this can be being involved with public concerns or issues within your community, or being a part of an organization that you want to volunteer for. Okay, and for the importance of volunteerism, why is this important to you? First of all, since a lot of you are in pre-health pathways, your pathways may require you to have volunteer experience or volunteer hours. And so this might be a prereq for you in your program in the future. And then second, to gain experience and learn new skills. Throughout your volunteer opportunity or experiences, you'll be learning gaining communication skills, teamwork skills, and other skills that can help you later on within your job or within your pathway. Third is to just make a difference within a community. Fourth is explore and discover career options. What's nice about volunteerism or volunteering is that you get to explore and reach out to other professionals within the field that you might be interested in, so you can kind of get a glimpse of what that field looks like to you or what your career pathway is. And I mentioned networking, so meeting people within the field. And then lastly, just gaining personal and professional growth. In a way, when you're volunteering, you get more experience and you can learn more about your area of interest. Okay, so how can you volunteer? So there's a lot of opportunities on campus. I can definitely look and research and explore. There's opportunities within your community, such as organizations you want to be a part of, and also just something that you're passionate about. I feel like a lot of students, sometimes they feel limited to volunteer opportunities that they can be a part of, but it might be something little that you can take. You can gain leadership skills or anything like that. That is a way to volunteer. And lastly, just opportunities that match your interests, your skills, or your schedule. Yep, and then next I'm going to pass it on to Ian to talk more about patient exposure.
Thanks, Jennifer. So this is going to be very similar to some of the volunteering things, but it's going to be a little more specific on some types that you'll actually see out there in the field. So patient exposure, it's an important thing for most pre-professional students to try and obtain, whether it's having to have it for like a prereq requirement or admission requirement, or just trying to learn more a little bit about the field you're interested in going to. It's important to get some sort of patient exposure. So like I mentioned earlier, it gives the student a little more familiarity with their chosen field to see if that's actually something they'd like to do rather than going into it blindly. And it also can help to establish a little bit of a greater and broader interest for that field. You'll actually get to learn more about what is kind of done on a day-to-day basis, and you'll also learn some rewarding aspects and some challenges that are associated with the particular thing you choose to do. So some opportunities that we commonly see with our students include opportunities in the hospital and different sorts of clinics, nursing facilities, hospice and physical rehab centers, and some that we've identified here locally, and we actually have some information on some of these later, is Hearts and Home Hospice, Keystone Hospice, and Home Watch Caregivers.
I'm in a meeting right now.
So similarly to patient exposure, we have observation. This is a little more, kind of like a shadowing opportunity as an example of this. And it has very similar reasons of why it's important. Again, you get to learn more about that field. It's important to have some general knowledge of the field and, preferably some experience when you're applying for these programs that you guys are interested in. You also, again, get to learn some duties of the actual particular role, as well as, the aspects of what an employee in that role will actually do. And some opportunities for shadowing we have identified for you guys are, just general offices. So with physicians or dentists, if you have a local one in the area or one back home, that's a great place to get started. There's also, health centers, hospitals, clinics, and then even some laboratories. And some of the common ones that we've identified here at BSU are at the Boise VA, Terry Riley, and then Genesis Community Health.
All right, it's with great pleasure that I'm introducing to you today Sarah Roundtree and Christelle Poole. They are individuals who run the on-demand program, which is a scribing opportunity. And so I would love to just let them talk to you a little bit about their program and how it works. It certainly is kind of a happy marriage, I think, between patient exposure and observation.
Just have to remember to unmute us.
We do it all the time.
We actually have a PowerPoint that we can share. Is that possible?
Let me give you co-host access and we'll go from there.
To Sarah.
To Sarah. Awesome sauce. Cool. Sarah, you should have co-host access now, so you should be able to share your screen.
Too many windows open.
I hear you.
All right. There we go. So first off, I wanted to thank Erin for inviting us to share our on-demand scribe program with you and a little bit about on-demand. I am Sarah Roundtree. I am the manager of the scribe program, but I also have Christelle here with us.
I'm the director of the scribe program. It's nice to see everybody.
Wanted to start by giving you a little bit of background about us. However, I'm going to go through the next slides pretty fast so we can get to like the meat of what we're here for. So On-Demand was established in 2006 when the administrative team from that supports an emergency provider group went from an employed model to a contracted services. On-demand staffing sits under an on-demand umbrella. So on-demand, we provide a selection of services, including staffing. I keep forgetting about that. Sorry. They're either offered altogether or a la carte.
The benefit of these other services that On-Demand provides is that it has added a unique experience besides just scribing, which we'll get into. We support clinicians. I say clinicians because it's not just physicians, it's mid-levels like nurse practitioners, physician assistants. We cover the gambit of administrative responsibilities, from billing and coding to staffing to practice administrative services.
So we have a list of clients supported under the on-demand umbrella. However, not all of our clients use scribes. The emergency department is our largest staffing client, followed by ortho and a women's health clinic that we have. So our program actually began in 2001 with a group of local emergency room providers until it found its home at On-Demand in 2007. So we have grown with that emergency group from 1 emergency department to 5. And then when we hire for specific client needs, and our training covers those needs. We have a tiered training program that starts with online, that's approximately 30 hours. classroom and floor training, which takes up the rest of the approximately 80 to 100 hours of training. So what does the scribe do, right? That's what you're all interested in. So scribes work under the personal supervision of a provider during each shift. They document history of present illnesses, review the systems, exams, procedure notes, the discharge pathways, and prescription writing.
You may be wondering what is that, but anybody interested in pre-medical studies of any sort, this is what you are going to get to at some point. And this is what scribes do on a daily basis.
So I went too far, different screens. Basic role. Sorry, we're going off two different screens here. The enhanced role may be limited by either the level of comfort the provider has with the scribe or the level of comfort the patient has with the scribe in the room, right?
The scribe still does the basic functions in the role as a scribe, but for those who are more experienced and have a better comfort with the provider, we have this additional enhanced role, and it's things that we do in addition to the basics of a scribe. So some little more things that sit between clinical and non-clinical realm, helping to set up sterile procedures, functioning in a sterile environment, assisting in holding a patient, whether it's for limb stabilization or other needs. But it's a little bit more interactive and just an opportunity to advance your experience.
My personal favorite is the limb stabilization. Just a little hint, upper body strength. So how to become a scribe, right? Above, or what you see, is a list of our basic requirements. Depending on positions available, we hire both full-time and part-time employees. And we ask for a minimum of 1 year for part-time employees. No, sorry, full-time employees, and 2 years for part-time employees.
The basic requirements are really dependent on whether it's a facility-based position like the emergency department, and facility being a hospital system. Non-facility would be a clinic. We follow the basic same requirements so that we have some scribes who are able to go in between. So they work in the emergency department some days, and then in other days they help fill positions in a clinic. It's limited in those roles that we have, but we try to onboard everybody similarly so that we have that freedom for experience for our scribes. So really, how to become a scribe? We don't have a huge application process. We're always collecting resumes, so if it's something that you're interested, you can send it in at any time. What we didn't really go into in these slides is what we talked about separately is the intangible experiences that you get being a scribe. Things that were mentioned by the previous presenters are things that you get to experience as a whole as a scribe. This isn't an internship, it's a paid job. So, you get that benefit of getting paid to do something that you are working towards. And it does meet the requirements of patient interactions and patient experience. Depending on what you are pursuing at Boise State, we have some of our employees who are students who also get credit for their experience as a scribe. The intangibles are the experience of working side by side with a clinician. And a clinician is a physician, nurse practitioner, physician assistant. We also work alongside the ancillary staff, nursing staff, CNAs, and we get that firsthand experience of what it's like to care for a patient from start to end. We see the decision-making process that the providers go through. You're immersed in the medical terminology, in the labs, radiology, treatment, all the things that you're working towards. It's a great experience that you get to have firsthand. And some of that stuff you don't actually get to experience until you are a clinician yourself. And clinician, we do seem to attract a lot of pre-medical student studies, but we have nursing students, pre-dental,
Currently as a respiratory therapist.
respiratory therapy. It's a well-rounded group of individuals, all with kind of a like mindset in this is a stepping stone onto the bigger picture. But we are collecting resumes currently for our next planned hire round this year, which is coming shortly. And we do have a deadline that we're asking for anybody who's interested to send them in by March 15th. We understand everybody here is in their freshman year, and maybe this isn't something that you're ready to think about yet. Save the information. It may be something that you're interested at a later time. Freshman year is a great time to get your footing under you, figure out how you are with your class schedule and your personal life. And those two things come first, then the job. We fully support at On Demand. Education comes first. So when we hire individuals, we take into account where you are in your studies, what is your workload each semester going in, because it's a hefty workload that scribing is itself. So just something to consider.
Questions you have for the on-demand staff?
I guess my question is, you're saying that it takes a lot of time. How much time commitment is it about a week? Like how many hours are you working?
We usually ask for 2 to 3 shifts per week of availability. And shifts for us are 8 hours altogether. The emergency department really seems to highlight well for students because we staff 24/7 and there's shifts scattered throughout the day and night, which facilitates that ever-changing schedule that you might have Monday, Wednesday, Friday compared to Tuesday, Thursday. But we also have our clinics, which are daytime.
Questions?
What's the biggest thing you guys are looking on a resume?
We get that question all the time. And to be honest, it's hard to give a single answer. Number one thing that we look at in the beginning is availability, because we do, like I said, take into consideration what is your workload, what kind of classes are you taking. For upper division students taking OChem and a physics class, we know that's probably going to be a really rough semester for you. So not the best time to maybe start. Availability is key for us. And the rest comes with the interactions that we have. What are you wanting to do? Are you self-motivated? Can you multitask? Are you good learning on your own and then working with somebody under the direction of somebody? Those aren't things that you can really list out in a resume, but those are the things that we look for. Those are all great questions, guys.
My understanding that On Demand facilitates most of the St. Luke's clinics. Is that correct still?
It varies. So St. Luke's, we do hold a contract exclusively with them. Currently, we provide services in the 5 emergency departments around this area. So Fruitland, Boise, Meridian, Nampa, and Elmore. Our group of providers also works at an urgent care, which we don't go to currently. We do provide services in different clinics at St. Luke's, rheumatology, orthopedics, which can expand. Others that use scribes at St. Luke's, they do it on an individual basis, not through a company, usually self-managed through somebody separately. They don't have a hard set standard.
Well, thank you so much for coming tonight. We know that your evening, you probably want that all back. We appreciate your time. This is another example, students, of an opportunity. Even if you're not thinking about going to medical school or PA school or something like that, this is experience, you know, something you're all craving. And I've had students in the years past who have said, gosh, I think I'm going to dental school. And they've done this opportunity and realized they wanted to be physicians. So, and vice versa. So it flips back and forth. So this is a great experience. So thank you so much for your time tonight. You are more than welcome to stay or leave or do what you need to do. We're going to go ahead and move on to the rest of our presentation.
Thank you for having us.
Thank you. All right, Shannon. You're up.
Okay. So we actually did invite Hearts and Home Hospice to come talk to us tonight, but unfortunately Desiree fell sick and couldn't come speak, but I will talk to her on her behalf. So Hearts and Home Hospice, working with patients who at home, end of life care, stuff like that, they are actually desperate for volunteers right now, and she's willing to take anyone and everyone. Currently, it's working with the phones. They're having people answer the phones right now, but as things are opening up, they're going to begin to send volunteers into the homes to work with the patients. What it requires, so what they're going to do is they're going to do a background check. They're going to check your driver's license and proof of insurance. They're not super worried about the insurance currently, as they can't send people out, but as that opportunity becomes available, you will want to make sure that you have insurance. They're doing one-on-one or group trainings. She's preferable to group trainings, but if that doesn't fit your schedule, she's so desperate for volunteer work that and help that they're willing to do one-on-one group trainings. It's got a lot of great benefits. Like you can set your own schedule, and there's no minimum amount of hours to be worked. You just have to sign a contract, etc., etc. It's a great opportunity. If any of you guys want information, I can give that to you. It's an online application. I can send you the link, and I can give you her contact information as well.
Hearts and Home Hospice has been for us a extremely valuable company organization to work with. Several of our physicians, students who were pre-med students started working as volunteers for Hearts and Home Hospice and are now physicians. And they're actually saying, gosh, you know, when we can get more people out there willing to let you even observe with those physicians in their family practices and their palliative care. They are also really great for hospice. You'll see occupational therapy. You'll see PT in hospice. I mean, it can be an opportunity for you to interact, and it's any kind of patient. If right now they're looking for people to use the phones, I mean, that's not a whole lot to ask of you as students. So if you're looking for any kind of volunteering, this is patient exposure and volunteering. So that's a nice deal. And there are other hospice companies as well. So keep that in mind as well. So the other one we wanted to talk to you about was St. Alphonsus. We did not get a chance to get a hold of, we did reach out to them, but they're pretty busy. but I did take a look at their website. So in years past, St. Alphonsus has targeted our students for these opportunities that do not require licenses. One of those is patient safety attendant. These individuals will sit with patients, and I looked at the St. Alphonsus website, and it looks like they have at least 5 to 10 positions open for patient safety attendants. These individuals could work in an emergency room, they can work on the floor, they can work in labor and delivery, where they're sitting with a patient to make sure that they're safe. So it could be as simple as someone who is, they're concerned about that they might fall if they get out of their bed, or one of my students who is now a graduate of University of Washington Medical School, she was a safety attendant, and she worked with a patient that had a tracheotomy, and he kept trying to take out his tube. And so she would just politely reach back up and grab his hand and say, nope, we're going to do something else today. I had another gentleman who did this patient safety attendant position. And these are paid jobs, by the way, and you can do them on like what's called PRN, where you get to like be on call, or you can do them with like a part-time version or a full-time version. And they have different facilities at St. Alphonsus that do that. The other really cool thing is being an orderly, or someone who will transport, give gifts or flowers, things like that. Those are all still things that are going on right now, even with the pandemic. So those are examples of things that you can do. St. Alphonsus also has their own scribing version. They have what's called Vituity. It's the company that they use for their scribing for all of their locations, and they are also hiring. So if anybody's interested in a scribing position, you can look at that. So St. Alphonsus is another location that there are jobs where you don't have to have a CNA license or a phlebotomy license. They also have volunteer activities in their rehab facilities and different locations as well. So it never hurts to ask if they need something or if they have some openings, but this is an example of an opportunity for sure. So that was the patient exposure piece and the volunteers piece for you. We've basically given you one of each. We've said, hey, here's your opportunity to volunteer. Here's an opportunity for patient exposure. And this list goes on and on and on. Shannon's going to talk to you a little bit about virtual observation opportunities.
Okay, so we're in the COVID world right now. And so as we all know, observation, volunteerism, it's tough. But there is virtual observation out there. And that is something that a lot of medical schools are taking and accepting. The things we want to recommend is, or remind you of, with online remote shadowing, is be careful. You don't have to pay for any of these types of experiences. If they ask you for money, get out of that website, get out of that experience. It's not going to be a good one. Make sure the organizations are using real practitioners. Like, I think that also can go with the money thing. And never use this as a substitute for in-person shadowing. You can't be in-person shadowing, but this is what we have currently. Just use this as an opportunity to gain relationships with practitioners across the country. Some examples of some great virtual observation opportunities are Club Med, the pre-health shadowing, and virtualshadowing.com. You can come to one of our school information sessions. We do them all the time. We've got at least 5 happening this month, I think, or at least 5. And then mentorship programs as well. If you want to do the links for Club Med, pre-health shadowing, or virtualshadowing.com, let me know and I can send those to you.
Whoop, can we go back one? One more. There we go. So there are in-person opportunities, and while they may feel like they're tight, we're starting to see some opening of things as we go. WorkU is not necessarily observation, but it gets you an opportunity to work for places like St. Alphonsus, St. Luke's, Blue Cross, where you might interact with some of these practitioners, whether they be occupational therapy or they be dentists, whatever it might be. If you're thinking about dentistry, there's dental offices that are taking shadowing, like Dr. Blaisdell in his office at Swan Falls. There's also my dentist, his cousin, is also taking a few observers as well. For occupational therapy, it might be something simple like going to like the sensory place or trying some clinics off the beaten path. For physical therapy or medicine, these are some options too. Taj orthopedic internships. So we usually get 2 people into intern with Dr. Taj. St. Alphonsus, I just put the link on there and we can post it into the chat as well. St. Alphonsus has their own observation expectations. We would suggest with St. Alphonsus and St. Luke's that you don't go in with the verbiage of saying shadowing. Don't say shadowing, say observation. And then also make sure that you're not using the word internship, because if you don't want to have to like pay for an extensive background check or go through all of this stuff, jump through these hoops, and that's not necessarily to get observation. So what you want to think about is using the words observation. With St. Alphonsus, you do have to have a practitioner already lined up. And then it does require a letter from our office. We have those, you can just ask us for them, indicating that we've encouraged you to have this experience. For St. Luke's, that's a little bit more kind of red tape, so to speak. You have to fill out a clinical form, my clinical exchange form, and do some of those things. And then they do like it when you find doctors. So if you get a no right now for shadowing from like St. Luke's or St. Alphonsus, but you strike up a relationship with an informational interview, then you can kind of hold on to some of that. Genesis World Mission, they have physicians and dentists. They also have a pharmacy and some of those things. Friendship Clinic is another one. Tara Riley is a community health care provider. And so they often give you some patient exposure opportunities where you can interact with our community members, maybe as contact tracing right now with COVID, or maybe you're helping take blood pressure and blood sugar levels at the Idaho Food Bank. Those are some examples of community health workers. We've of course listed Hearts at Home Hospice. We have a connection with Dr. Billy Gallagher, who was actually named one of the really cool, he got a special honor just recently. He's now been named one of the, he can plan his own hospice care community, which is pretty awesome. He's one of our graduates and he worked for Hearts at Home Hospice as a volunteer, and he is offered to allow for shadowing. I've also listed Atlantis. Atlantis is a mostly pre-med observation in other countries. The only thing I warn about that is you have to pay your way. So you have to pay for the trip. But the experience can be pretty amazing. You get to shadow real MDs, real allopathic medical physicians. The only catch is that you wouldn't want that to be the only way that you shadow or observe. If you're thinking about going into becoming a physician, you would want to shadow a US doctor along with this experience, but it is still going, they are still doing it. So it's something to think about too, in terms of gaining some of that patient exposure. There's many different summer opportunities too. So before we move to the activity that we have planned for you today, any questions about that? Any comments, questions? Okay, so here's what we're going to do. We have 4 videos that we have recorded of mission recruiters. So mission folks, 3 of them are med, but even if you're thinking about dentistry or you're thinking about PT, I want you to put yourself, your head, just because it's Idaho College of Osteopathic Medicine doesn't mean that a dental school wouldn't say the same exact things. So wherever they say med school or physician, put your career choice or your career path in its place. So what we're going to do is I'm going to send each of you a video and you're going to watch it. It's about 5 minutes long and it asks the same 3 questions in each video. So each of you will have kind of some perspective. And then we're going to put you in a breakout room with a facilitator and another person, and you need to tell them what video you watched and what you learned, and then we'll meet as a group. So give me 1 second to kind of get the ball rolling here.